history of cancers in your family, early detection and prevention are one of the more important things you can do. Dr. Roland Reyna with Health Texas is here to talk about things we can do to cut our risks. Good morning, doctor.
Good morning. Good Sunday to you.
Yes, good Sunday to you too. Always good to talk to a doctor about prevention. And so some of the forms of cancers out there are what, and what are the leading causes?
It's really different for what part of the country or what part of the world you're from even. The most common cancer deaths in this country, number one by and away, is lung cancer. And 85% of people who smoke, 85% of people who've had lung cancer smoked. So there's something that you can do to prevent it. Either don't smoke or keep away from it. Secondhand smoke is also incredibly bad as well.
Exactly.
Now the problem with lung cancer is that even though it's so common, it can be prevented by not smoking. But unfortunately, there's no early detection for it that's been shown to be effective.
And it's very common in both men and women. It's not gender specific or anything like that.
It isn't, and it actually kills more women. It doubles the risk of death than breast cancer. So women are generally more afraid of breast cancer when in fact lung cancer is much more prevalent.
Wow. So we got lung cancer, breast cancer, cervical cancer as well.
Cervical cancer is one of the things that we can really find very early. Through regular screenings, through your gynecologist or your primary care doctor, you have the cervical screenings, the pap smears, every 1 to 3 years. And generally speaking, after the age of 65, if there's nothing of any importance, you can quit the cervical cancer screening. The pap smears are no longer necessary.
Okay, and also colon cancer.
Colon cancer is the second leading cause of death from cancer in this country. And this is another situation. I guess the big message is there's a lot we can do about all these things. Mammograms with breast cancer screening, and there's very effective ways of screening for colon cancer, to the extent to where if you have the colon cancer screening, you can almost 100% prevent these things. They have recommendations. The recommendations that most doctors follow are recommendations put out by a national organization called the United States Preventive Task Force Services. And the cancer screening for colon starts at the age of 50. We don't really know where it ends, but somewhere after the age of 70 to 75, you end up, if you're doing too many things to too many people too often, you can actually have complications from some of the screenings as well.
Wow. Okay, so you say, let's backtrack a little bit because I want to get back to the ages.
Yeah.
I mentioned to you earlier before the show that I know a lot of ladies out there who are in their 30s that are being asked by their doctors, you've got to go get a mammogram. And so when it comes to breast cancer prevention, is that necessary? Because you say between 40 and 70, or starting when you're 40.
Yeah, the science says starting at the age of 40. The problem is when you have a young, healthy woman, women have normally fatty, dense tissue. The younger you are, the more dense it tends to be. So you're going to have a lot of false positives. That is, it says there's something there, and the problem is when you get a mammogram and you're kind of stuck, because if there's an abnormality, then you're forced to biopsy it. And I can't tell you the amount of stress that goes along with telling a young woman, you have something wrong there, you have to biopsy it.
Wow.
It's very stressful.
So do you recommend that then in your 30s? Or I guess if you have a family history?
I think every woman needs to talk to their doctor specifically, but for the most part, the science shows beginning at the age of 40 and ending somewhere between 70 and 75.
Okay, and then going back also to cervical cancer, what do you recommend again as far as
the recommendations for younger women who are more sexually active, generally on a yearly basis, but after you've been in a monogamous relationship, you can go every 2 or 3 years if everything else has been okay.
Okay, and then again, colon cancer, if you're 50, start talking to your doctor about it?
Absolutely. My father had colon cancer, and because of my family history, I just recently had a colonoscopy, found a big polyp, had to be removed piecemeal. So that probably saved my life.
Wow.
So beginning at the age of 50, that's right. There are different ways of screening for colon cancer. There's something called stool Guaiac cards, where you actually give your doctor a sample of stool.
Oh, wow.
And you put it on the card, or colonoscopy every 10 years if it's normal.
Well, it's so necessary. You got to get that done. And lastly, let's go ahead and talk about Health Texas Med Group and who
Yeah.
you guys are.
You know, we're a group of 17 primary care doctors who work all over San Antonio. We've got 10 offices. We have something called an Art and the Quality of Medicine program where we incentivize our doctors to screen for these things. So what we have done in our medical group, this is a small medical group in San Antonio, we have doubled and tripled the national rates for colon cancer screening. Amazing.
That's good.
Our doctors screen 90 to 100% for mammograms for our female patients. Just amazing things that we can do when you really focus and you really work hard at these things and you care about them. So what I would tell our patients is that listen to your doctor, and if the doctor doesn't recommend it, ask your doctor.
Ask your doctor.
Yeah.
Definitely, you got to do that. You got to ask your doctor, visit your doctor regularly, and once you get to that certain age where these tests, these screenings are coming up, you got to do them.
Starts at about 40 and 50, that's right.
Wow. Well, thank you so much, Dr. Reyna. I want to go ahead and give the folks at home some information about Health Texas Medical Group. All you need really is a phone number because you've got different doctors
We've got
around
10
town.
offices, that's right.
10 offices, 10 locations. So here's a phone number. It's 210-731-4864. Start getting those screenings out of the way.
That's right.
Yeah, thank you again, Doctor.
Thank you.
All
Good
right,
deal.
later.